Hello everyone, welcome to Med Shorts, which explains the most important topics of your med school within 5 minutes to make your work easier. Today's topic is from the subject microbiology, and I selected this question, which is in the form of a clinical vignette, to explain the topic. And it reads: a 35 years old female patient came to the physician with complaints of fever, dysuria, and flank pain. On examination, temperature is 100, blood pressure is 125 by 80, pulse rate is 92 per minute. Urine dipstick is positive for leukocyte esterase and nitrite test. Urine culture on EMB agar demonstrates green metallic sheen showing gram-negative motile rods. So the question proper here is, what is the virulence factor responsible? To know what is the virulence factor responsible, to know the answer, we have to know what is the condition and what is the organism that is causing that condition. Because every organism causes n number of conditions using different types of virulence factors which maybe are specific to that condition. So let's break the question to approach the answer. So the history says the patient is female and she is having a complaint of fever, dysuria, flank pain, and her temperature is raised by 2 degrees, blood pressure is normal, and pulse rate is in accordance with the temperature. So a female patient complaining dysuria and fever and rest of the things are pretty much normal signifies that she may be suffering from UTI, because UTI is more common in females. So the lab shows urine dipstick is positive for leukocyte esterase and nitrite tests. So what are these tests? These tests, if positive, indicate that there may be UTI going on. Leukocyte esterase says that there is something going on with WBCs in the urine, and nitrite test states that the organism might be gram negative organism. So the microbiology lab shows the urine culture we are having EMB agar demonstrates green metallic sheen and it is showing gram negative motile rods. So gram negative motile rods causing UTI. We have E. coli and Klebsiella in the picture because they are the most common ones which cause UTI and which are gram negative. So the question itself says that they are motile. So we can exclude Klebsiella because these are non-motile. And they also said that the culture showed green metallic sheen on EMB agar, which is the characteristic culture thing for E. coli, which shows green metallic sheen. And Klebsiella, on the other hand, shows pink mucoid colonies. So we can exclude Klebsiella as it said green metallic sheen, which is specific for E. coli. We had the diagnosis of E. coli. So we have to know the virulence factor of E. coli, which causes UTI. Before jumping into the answer, let me say that E. coli has 5 virulence factors which produce 5 different kinds of conditions. So to remember, E. coli has 5 letters, so there are 5 virulence factors. So what are those? Number 1, enterotoxin. The word itself says that it is something dealing with your gut. So it causes watery diarrhea, and the mechanism is same as the other diarrhea conditions, that is increase in the fluid and electrolyte secretions into the gut. And you have the second virulence factor is K1 capsular antigen, which causes neonatal meningitis, and the mechanism is it prevents phagocytosis, even the complement system. So number 3 is verotoxin, which is also called Shiga-like toxin, which causes bloody diarrhea, and the mechanism is it inhibits 60S ribosomes. As a result, cell death is going to happen, so that cell death causes bloody diarrhea. Number 4 is lipopolysaccharide, which causes gram-negative sepsis. Lipopolysaccharide is present in many of the gram-negative organisms which cause sepsis most commonly, and there is a whole lot of different story to know about the mechanism of gram-negative sepsis, which I promise you that I'm going to deal in the other video because it is so much important for many other competitive exams and also for the university exams. Number 5 is Fimbria, which is our question proper. It causes UTI because Fimbria help the E. coli to hold on to the uroepithelium to colonize there and to produce the symptoms of UTI. So these are the 5 virulence factors that you need to keep in your brain when you're talking about E. coli. So how to remember this when you're in crisis, in the middle of exam or in the MCQ exams, you're in the panic state, how to remember these 5 things. So I created a little mnemonic using the organism spelling itself. So enterotoxin, E signifies enterotoxin, C for capsular, and in virotoxin extract that O, and in 60S extract that 0, make it a round. E. coli, lipopolysaccharide, L. Fimbria, extract that I from Fimbria and I from UTI and keep it here. So it's E. coli, enterotoxin, capsular, verotoxin, lipopolysaccharide, and Fimbria. So the answer here, the virulence factor which is responsible for causing UTI in this patient suffering with E. coli infection is Fimbria. So this is the topic, guys. If you like the video, consider to hit the like button and share with your fellow friends, and uh, just comment what are the changes I had to make a better video for you, and what are the other topics that I can help you with. Thank you so much.